I lost my appetite, how come I'm still so big?
Well, that's a good question, but you've lost 9 pounds in 3 weeks.
Yeah.
So you are losing weight. But that's not how we want to lose it. If you told me you were trying to lose weight, that'd be one thing. Now, part of that, you know, I guess the big question I have is her symptoms coming from the Haldol, the generic haloperidol?
Do what?
The medicine we put her to help calm things down when she was having all that obsessive thought about the wallet stuff.
Yeah.
Are we having side effects? That would be the first question to my mind, would be, is it side effects?
Right.
And those are possible side effects to haloperidol.
Does she still need to be on it now? I mean, I don't know if he's told you they found it.
Right, he told me that last time, and we talked about it, and I said, well, is she going to obsess about
she still
something
worries
else?
about it.
Right.
Oh,
See?
okay. Mm-hmm.
You
So-
heard her ask about that checkbook how many times?
Right.
My first thing would be, let's stop that and see what happens.
Mm-hmm.
I don't think we have to wean off. We can just try stopping it.
Mm-hmm.
Because those are possible side effects of this medicine.
So, I didn't realize until today that she wasn't on Aricept anymore. She's on Nadina?
Namenda.
Is that any better than one or the other?
You know, she doesn't have Alzheimer's disease. Both of those medications were developed for Alzheimer's dementia. And
So you're saying she doesn't have?
she does not have Alzheimer's. Does not appear to be Alzheimer's.
So just,
She does have a form of dementia.
uh-huh.
Those medications were developed for Alzheimer's.
Mm-hmm.
Neurologists often use those medications in hope that they may give some benefit.
Mm-hmm.
I have not read any studies that have been done on those medications outside of Alzheimer's disease. So there's a question, and a pretty big question mark, do they do anything for the other types of dementia that there are there? Dementia is a progressive cognitive, higher levels of thinking problem with memory loss is basically what dementia is. There's different forms. Alzheimer's is what most people think of with dementia. Obviously it's the most aggressive type of dementia. But there's other types of dementia. One we call senile dementia, which is just the usual aging process that some people start losing memory. It's usually the least aggressive. And then there's other types like what we call multi-infarct dementia, which is where people have little tiny strokes in their brain over time that can cause dementia.
And she had, I don't know if that's, I mean, I'm sure that maybe on her record, but she had passed out a few times in the past, so was...
Whether that's strokes and, you know, it's difficult to say.
Okay.
Let's see here though. Let me see what we have done already.
I don't know that I feel like it's gotten worse. I feel like it's been the same for a few years, but I guess my big question is, does it progressively get worse?
It can, and that's what I'm looking back to see what tests we've done, because I don't recall which type we had documented for her. I'm just looking back to see what tests we've done and who has seen her and so forth. Yeah, we did an MRI of the brain. She had one in 06 and then another one in 07. The one in '07 just noted chronic white matter ischemic change. So it looks like this is that multi-infarct type. That means that the blood flow to the brain has not been as good as it should. Causes little tiny strokes over time and can cause the types of problems that she's had.
She had, some blockage in her carotid, but it wasn't enough at the time to do anything about it.
And that fixing the carotids is probably not going to fix that.
Okay.
This is the small blood vessels.
Okay.
I'm just looking now to see, did we refer her during that time period to see a neurologist or anything? Let's see. I don't remember off the top of my head. Yeah, she did. She saw Dr. Odenheimer in 2005.
I don't think that was a recommendation by your office, though. It was, I think we just went on our own.
Which is fine, and that's fine. And he did some workup, and that's actually where Namenda and Aricept came up.
Okay.
Yeah.
And as I said, I see neurologists do this. Whether it makes any difference or not in the long run, it's difficult to say. But it's not going to reverse.
Sure.
It's not going to fix anything that's already occurred. Neither the Namenda or the Aricept. But he put, at that time, in-vessel cerebrovascular disease, same sort of thinking. Small blood vessels that are affecting the memory.
It won't reverse it, but is there something that will stop it from getting worse? Or?
If it is not Alzheimer's, no.
Okay.
And even with Alzheimer's, those medications just slow down the
it down.
progression. They don't stop it, they don't reverse it, they just slow it down.
Okay.
So, that's kind of where we are. It looks like it's, like I said, multi-infarct dementia. Just looking at what's been done in the past. As I said before, the fatigue and the nausea and the weight loss is probably due to the nausea because she's not probably eating as much. Is probably what's going on there. So, as I said before, my first thing would be let's stop the haloperidol and see what happens.
Okay.
See if the nausea goes away and the fatigue goes away. If it does, that's fine. If we have irritability and agitation and
we won't be able to tell.
if those worsen, then we can try some other medications. The problem with the other medications, and even with haloperidol to some extent, but that's the reason I chose this one, is it's not as much. But all causes of death go up with using these antipsychotic medications in people over the age of 65.
Okay.
So what do we do? That's the big question. What do we do for somebody who's having the agitation and irritability? Most of the time, I tell the patients' families that that's, a risk. But the other alternative is doing nothing or putting them on medicines that are going to sedate them. And that's really not a good option either.
So are you who saw her at the ER when Dad brought her in, or did you bring her into here?
No, they've been here to see me.
When she couldn't get over the billfold incident, the wallet incident, you brought her here? Or I thought you brought her to the ER.
Well, I brought her over there, but I'll come here too.
Oh, okay.
Yeah, I think they've been seen there, and then
I went there.
So I guess I'm asking, was it you who prescribed halo?
Yes, that was me.
Oh, okay.
And as I said, it was to help with those obsessive thoughts, because we talked about reason, how to reason, and there was no reasoning. So
right.
And we didn't start on that strong medicine either.
we kind of
That was
built
over
up.
a period of time before we done that.
Okay. One more question. My father-in-law's a pastor in Alabama, and telling him about some of Mom's stuff, he said that some ladies in his church had kind of done the same thing, and they started seeing a geriatrics doctor. Not to discredit you, is it better?
That's a choice. I'm going to say no. I feel like I do a good job, and I see lots of geriatric patients. That's up to y'all as a family, or whatever you feel. And it's not